We know that because HAE is a rare disease, getting an accurate and timely diagnosis poses a significant challenge, but it is a vital first step towards obtaining effective treatment.
Right. The HAE diagnosis is complicated by the fact that the vast majority of patients who see a doctor because of swelling are diagnosed with an allergic reaction to food, medications, or something that's come in contact with the skin. According to researchers, hereditary angioedema comprises only 2% of all angioedema cases.
So what causes HAE and how is it diagnosed?
There are three types of hereditary angioedema: type 1, type 2, and type 3. HAE1 and HAE2 patients have a genetic defect that causes a deficiency in the blood protein called C1 inhibitor. Inadequate C1 inhibitor protein fails to do its job to stop certain biochemical processes that ultimately result in swelling. Type 1 patients have inadequate levels of C1 inhibitor protein. Type 2 patients have normal levels of C1 inhibitor, but it does not function properly. 15% of patients with C1 inhibitor deficiency have type 2 HAE. Type 3 patients have normal levels of C1 inhibitor, but have swelling attacks and a family history like patients with types 1 and 2. Current research indicates that HAE type 3 occurs mostly in women and could be associated with mutations in the coagulation factor 12 gene or other unidentified defects. The HAE Association is working with its medical advisory board to sponsor research to illuminate the causes of and treatments for HAE type 3.
What about acquired angioedema?
Acquired C1 inhibitor deficiency, also known as acquired angioedema, is very rare and should be suspected in patients who 1. Have C1 inhibitor deficiency with no family history, and 2. Did not begin having symptoms until sometime after the age of 40. Acquired angioedema is often caused by lymphoma that hasn't been diagnosed. However, there are an extremely small number of patients who produce antibodies that consume their C1 inhibitor protein.
What laboratory tests do doctors use to diagnose hereditary angioedema?
Laboratory tests to confirm HAE due to C1 inhibitor deficiency can be performed and interpreted in most doctors' offices. These lab tests include, number 1, C1 inhibitor quantitative levels. This measures the amount of protein in the blood. Number 2, C1 inhibitor functional tests. This looks to see how well that protein works. And number 3, C4 levels, which is an excellent screening test for C1 inhibitor deficiency. Genetic testing for HAE type 3 is now available at the National Jewish Health Advanced Diagnostic Laboratory in Denver, Colorado, although these tests will only identify some patients with the condition. Doctors recommend that the children of all HAE patients get tested even if no symptoms have been experienced, and testing is recommended at about age 1 or older. That way, everyone will be aware that swelling of the mouth or throat may be HAE related and require immediate medical attention.
The HAE Association urges anyone who suffers from recurrent bouts of unexplained swelling to be tested for HAE.